I had the opportunity of meeting Dr. Nadine Lindsay, a co-founder and operating manager of DelCare Health Solutions based in Wilmington, Delaware. Her story is inspiring considering the fact that she started off as a healthcare giver and rose through the ranks to a point of obtaining a doctorate degree and starting her own practice. Also, she is an immigrant to the United States, originally from Jamaica. I sat with her and we discussed various topics. Today on the Uplift Chronicles podcast, we have Dr. Nadine Lindsay. She is the managing partner and founder of DelCare Health Solutions in Wilmington, Delaware. Doctor, you're welcome.
Thank you.
And Dr. Nadine also has a master's and also is a certified nurse practitioner. She also has a doctorate as well. She has experience in academia and then she jumped into practice. So Dr. Nadine, welcome again. And it's a pleasure to have you here.
Thank you. Thank you, Kofi. Thank you.
Yeah. So tell us a little bit more about the birth of the DelCare Health Services and about yourself a little bit and what really drew you to healthcare.
Okay, thank you so much. Thanks for having me today. And DelCare, actually, DelCare. I'm the co-founder of DelCare. There is someone else involved. DelCare was actually created because two people identified that the community had needs. As nurses, we realized that the community, especially the underserved community, there was so much need to create a space for individuals where they would feel welcome, where they would be able to be themselves while getting, holistic care. And as a result of that, DelCare became an organization. So it basically was out of, the love for people and wanting to, like I said, create that space where they could get not just care, but patient-centered, high quality care because we cared.
Yeah, that's very impressive. And also just kind of I've followed you in different spheres in the community doing other things within the community building. And one thing that I was interested in is you're building relationships with people to understand their holistic needs, as just like you said, and collaborating with each other. You've been involved with some organizations in the community, such as the DSCSC. So how did you see that as a very imperative collaboration with these organizations when it comes to incorporating healthcare and awareness?
Great question. As nurses, we are in the business of providing care. And one of the things about healthcare, it's very difficult to survive in healthcare if you are not able to collaborate. Right. And so when you think of organizations like the DAC, that is a community organization, you're looking at the broader spectrum of people, diasporans, right?
Mhm.
Whether you're whether you were born on the continent, whether you're from New York, whether you're from the Caribbean, right? As a people, when you come to places like you migrate, and it doesn't matter where you migrate to, there is an absolute need for you to be able to connect with people and formulate those relationships. And so as a result of that, for me, community building, it's about how do we as a people figure out how to provide care for those in need, again, based on who they are in their special space, and whether it is, like I said, on the continent or here in the United States. How do we collaborate? How do we provide a sphere where we can have better human interaction, better healthcare in human beings? It takes a village, as people always say, it takes a village. A lot of times it takes collaborative effort for us to be able to connect with these individuals in these various spheres, create, those relationships, right? Teach each other, learn from each other. We live in a very diverse world.
Yes.
And so it becomes really crucial for us to develop the attitude of being able to collaborate and work and provide and help each other.
Yes. Yeah, absolutely. Thank you. And your story is a very interesting one because I know you are you're originally from Jamaica and you migrated into the United States and you've been through a lot of challenging moments to get where you are, right? So many foreigners or many people who migrated to the United States have their unique story. I'm pretty sure you have your unique story. On a night share, well, how was it like? What are some of the challenges? Personally and probably also in starting up DelCare Health Solutions as well.
Quite interesting. Yes, it was. Indeed, it was. You are in a different space. I left my little island of Jamaica and I came here, but it was a culture shock.
Yeah.
I'm from my small, little town, and then here I am in the United States, and these things are adjustments. When you have, as developed and you're accustomed to living your life a certain way, and then you're removed from that atmosphere and you're forced to move to another area or willingly move to another area, and you have to learn the culture. Sometimes it is challenging. And I remember coming here and I had a lot of challenges. I became homesick at some point. But my goal was, again, like I said, just to continue building, right? Working with people. And so, because back in Jamaica, I also worked for a medical center. And so even my transition into education was pretty interesting. It was
Right.
pretty interesting, right?
Yeah.
And I uniquely tell people, I said, in the Caribbean system, which is the British system, a comprehension passage, you are actually reading and you write your answers. When I came to the United States, they gave me 4 answers to choose from. They all just didn't seem like what I wanted, right? And so I had to relearn and train myself on how to pick a question, answer these questions. And so whether it was the personal aspect or the professional aspect, there are challenges. It's a lot of navigation that has to be done, and it takes a lot of commitment and perseverance, and pretty much that's what I did.
Yeah. Great story. I really like that. As this platform is always a platform people to share their story and inspire others. Okay, mostly people from the Afro origin, but also as a holistic inspiration platform. Also, I know you did visit Africa a couple of times. Also, in seek of knowledge, in seek of experience, also in trying to see how you can incorporate your beliefs and core values and missions in healthcare into Africa. So, can you tell me more about your journeys to Africa?
Yes, thank you. I'm excited to talk about it. And so my journey, yes, to Africa. I have a girlfriend and she's also a nurse. And I decided to take the trip with her actually. She started an organization and we decided to go to Africa. And as I went there, I remember it was just pretty exciting landing in Sierra Leone, and I felt like I was home. And the resemblance of the buildings in Jamaica and the ones in Sierra Leone are just like so identical. More
You
so,
went to Sierra Leone. And did you go to Liberia as well?
yes,
Okay. All
yes.
right.
I actually went to Liberia,
Okay.
but the plane landed in Sierra Leone for them to drop off, pick up.
Oh, okay.
So that was the first place I
Okay.
actually landed in Africa.
Nice. Nice.
Yes.
Yeah.
So it was an amazing experience. I remember just thinking, I'm home. I made it home. I made it home. I made it home. But more importantly, Kofi, the 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 longing, that urge, that need to do something for the people of West Africa, just fueled me to get up each morning and to just get outside and to interact with the people. It was an amazing experience. I find that people were so welcoming. People were just just wanted to help you in any way they can. But I also find that there's so much that needs to be done in terms of healthcare in Liberia that currently we are in the planning processes of really starting an organization, a healthcare organization there, so we can get into these villages and provide care for individuals who really need it. I really had an experience there, if I may add. I wasn't feeling well, and I went to the pharmacy to get a nasal spray. And I keep the nasal spray to this very day because the gentleman that owned the pharmacy, when he told me the price of the nasal spray, I thought he was joking. And so as I spoke to the gentleman in the pharmacy, I remember saying to him that when I spoke to the young lady in the hotel, the housekeeper, she the amount of money that she told me that she paid she got paid on a monthly basis. There's no way she could afford to buy that nasal spray
Right.
if she was sick. And so, thank you.
Yeah.
And so,
Yeah.
for me, that was like, oh my goodness, there is work to be done. And so, the fire has been burning ever since. My world, I'm surrounded with Ghanaians and those are my people. It seemed like Liberians, West Africans are like all around me, and it has been since the day I came to this country. And so for me, it was just being home and going home, and what do you do home?
Right. Yes.
I think, and I hope I can create a forum someday where we can do more cultural exchanges between the motherland and countries and the Caribbean islands of Jamaica and
Yes.
Trinidad, and so we can connect more with our roots, because we're missing a lot just by not being able to interact as much with our people.
Yes, absolutely. The expense of some of the medical and access to affordable health care in Africa could be a challenge. And I've been speaking to some people also, and there are introduced some sort of insurance coverages in certain countries. I know Ghana has initiated some sort of insurance. People can insurance scheme that pay for some of the things. So I'm hoping to see more of those in Africa and just trying to create an affordable healthcare for most people. But we do appreciate people such as you and other organizations that do the tech initiatives in trying to bring healthcare to especially the remote areas in Africa. Yes, we do appreciate that a lot.
Thank you.
Yes.
Thank you.
And
It is
anywhere
a
we
need.
can be helpful in at least creating that awareness, please come back here and we'll share with others as well.
It is a need when you think about Africa in retrospect, and the fact that an estimated 70% of the population is age 30 or below. It speaks volume.
It's baseball.
It says that there is work to be done on the continent.
Yes. Yeah. And there is tremendous amount of work, but there's always room for improvement. That's how it is. Yeah, definitely Africa, it's a place where a lot of great things are gonna happen or they're happening right now. So the focus should be there as well. Yeah.
I agree.
Yeah. So I know DelCare Health Solutions, where we were happy to see this open up in our community. I was here when you opened up this place, and by then I think he was Governor May was here.
At the time, he was at the county. He
That
was the county executive.
County
Yes,
executive.
now
Yes.
governor.
He's now governor. To
Yes.
see that, and he's been very instrumental in helping out, especially minority businesses and stuff like that. So it's good to see how far you've come with healthcare solutions. Congratulations.
Thank you. Thank
Yes,
you.
yes.
We're growing pains, Kofi. We're growing pains. But I say this, we came here to provide healthcare to the community. And that's what we're doing.
Yes,
we do it with a smile each day, and we do it amidst the challenges that immerse in the healthcare system. But on a daily basis, it's a daily grind. And we give thanks for the people as well, because a lot of times they let you know that they appreciate you. And those are the days you drive home thinking, I'm just grateful for today.
Yes, absolutely. And then also one of the impressive things that I've seen, you do take in students here for, I think, clinicals or practicals, so I'm not sure the right term, but Yeah.
Great. Yes, you're on it. Clinical's
Yeah.
practical. You did it right. So one of the very word solutions we named DelCare Health Solutions because we wanted to do multiple things under the umbrella of the organization.
Mm.
So unlike naming it, something, so and so practice, we decided to name it DelCare Health Solutions.
Mm.
We thought about workforce development in the community,
Mhm.
right? So if you think about it, while we're providing healthcare services to the community, we're also focused heavy. We should also be focused on things like workforce development because look, if you get people in and you train them how to do certain things, they can go out and they can find in the workforce. They can find jobs, right? They can
Yes,
provide for their families, right?
absolutely.
And on the other front, you talked about clinicals. Of course, we were students, right? I was a student, right? And physicians and nurse practitioners, right, took me in and mentored me and fostered me. And as a result of that, I am here today. I am here to assist and work with my community today, right? So with all that said, DelCare, I am committed to ensuring that DelCare Health Solutions remain a driving force when it comes to educating the upcoming nurse practitioners. And so we are a teaching practice, right? We're a teaching practice. So on a daily basis, you will come in here and I will have students from multiple universities. I precept students from multiple universities around the area, maybe, I don't know, Jefferson, and I could, Widener, I'm sorry. And I could continue just naming universities that we do precept students for. And I know I do precept students at the master's level for the family nurse practitioner or adult and geriatric nurse practitioner, as well as doctoral students. The thing about DelCare is that we provide a wide array of services. And so we're able to bring these upcoming professionals in and give them what I say to them. You bring the knowledge from the didactic aspect that you get from your university. You bring that to me, and I help you to refine those knowledge and skills and get you ready to transition to working. Because let me tell you, we need good people in healthcare, Kofi. We need strong people. We need people who are committed. We need people who are here for the cause.
Yes, absolutely. And we are so grateful for all that you do.
Thank
Yeah.
you.
All this sounds very rosary and, like everything is all set up. But I can guarantee you there are some challenges, or there's still some challenges that DelCare Health Solutions faces. Somebody might be thinking about, okay, I'm going this route. I want to start, my own practice and stuff like that. But what are some of the challenges that you face?
That's an interesting question. I really like that question because you know what? As a clinician, as a family nurse practitioner, my professors were the most phenomenal professors that you can think of. From Widener, I'm a proud product of Widener University and Widener Pride, or Newman Knights to Widener Pride. And I learned a lot. But one of the things that is not included in our curriculum is business. Interestingly, studies have shown that a large percentage of advanced practice nurses like myself, we do go into business. But here's the kicker. The challenges come when you have to deal with that business aspect. Okay. Walking in, the practice door was opened 4 years ago, right? To be exact, 4 years ago, June 3rd, 2021. The doors were open and we thought patients would come in, right? But it was not happening, not that way. Okay, we find that 4 years later, people are still walking up and asking, "What do you have in there? A church?" Right? They are unaware but what was missed largely was the fact that we needed to start marketing, right?
Yes.
And so I say to anyone out there, any colleague out there we're grateful in Delaware, we have full practice authority and we can open our own practices. But I say to you, if you are about to open a practice, you're thinking about it, you want to do it, please do, because people need healthcare. But please think about the business aspects of it. Think about the marketing, right? Think about the manual labor that would be required, right? And whether whether you have the human resource skills that are needed to hire the right team, because you have to build the right team. If you don't have what it takes to build the right team, you will have to do much of the work yourself. And so I work long hours because a lot of times I have to bend backward, pick up slack, ensuring that things are done correctly. Because like I said, I have a nursing degree. I was not trained as a management or in finance or in marketing. And so those things for us becomes challenging in business. And so for anyone, like I said, is thinking of doing it, just ensure that you're talking to the right people. Collaboration also really helps. I remember when we were thinking of opening the practice, we had a lot of conversations with partner young ladies who already had their practice, and a lot from that Kofi we generated a lot of information. They were very helpful. So again, I spoke earlier about the importance of collaboration. It is important you talk to others, you find out how to navigate the system. Again, it's a challenging system, but I tell you what, I feel a sense of accomplishment in the sense that I am able to provide care for my patients on a daily basis amidst the challenges that exist. And, we just continue to push, you know, as we go along. And allow me to say, a lot of the things that are done from the business front and the challenges is you learn by trial and error. You made those mistakes, Kofi, and you learn to kind of just balance. Like, okay, I made that mistake 3 years ago. Let me see if I change things and do things a different way. But pretty much, yes, that is how we have navigated it. I have navigated the system.
Yes. Yeah, that's good. Now you set a template for most people. I mean, there are other templates over there on some of these things, but hey, in business they say nothing ventured, nothing gained. So you have to definitely do something and keep pushing. And thank you for that encouragement, and thank you for sharing all those challenges that you have. Talking about treatment and diseases, what are some of uh, treatment or diseases that the clinic, the practice addresses?
Okay, let me allow you to keep me on track. Okay, let me just add something before. Is that okay?
Yes.
And so, as a family practice, one of the things that we wanted to do at DelCare is to create, like I said, a space where people come to get care in a relaxed atmosphere. And so with that came the services. Now, what services do we provide? And here we are a family practice. Let me say that we're a family practice. So we see children, babies from babies all the way up, infants all the way up. And we provide a wide array of services. We provide services, additional service. So if you want, we do family practice. So we do chronic disease management, which allow me to get back to the chronic disease management. But we do walk-ins on a daily basis. We offer walk-ins. So if our patients are not feeling well, they can walk into us and we see them. We do virtual visits. We have a very vibrant virtual visit platform. We do um, we do primary home care. So if you are at home and you're a shut-in and you're having issues, we get ourselves ready and we will get out there and we will make sure that you get care. We do travel vaccines as well. So if you're traveling to West Africa, East Africa, South and Central America, and you are going to an area where you need vaccines, please, by all means, stop in here and let us take care of you. We do weight management. So for the individuals out there, my ladies going on vacation this summer, and you think you just need to, kind of do some shifts in terms of your weight, come on in. I have something here for everyone. I promise you this. And I've had very good success rate. And you feel free to go on the website and check it out because my testimonials there will attest for the work that we do here, because we work on the psyche as well as the soma. We work on you mentally as well as physically. So again, give us a shot. But come on, give us a look, come on in. But Kofi, in terms of the chronic care, we see everything. We see a wide array of different disease processes. Okay. And so, like I said, if you're sick, if you're having just an issue, let's say you have sinusitis, you can come on in, do a walk-in visit, schedule an appointment. That's fine. But we do a lot of chronic care management as well. And so, whether it is hypertension or diabetes or kidney disease in the early stages, we take care of our patients on a daily basis. We monitor our patient on a weekly, regular basis. So we do the chronic care management here. So like I said, you can think about it. If you have a heart condition, you might have a cardiologist, but they'll also tell you need a primary care provider because there are certain things that we have to do here. The patients come into us and they need specialist care. They're referred out as deemed appropriately, but we manage a wide array of chronic diseases here.
Yeah, that's interesting.
We do women's health. Give me an opportunity. I'm sorry.
Yeah, go ahead.
We do women's health. We do men's health. I have so many. We do physicals, right?
Yes.
So if there's someone out there who wants to get a physical done, we do physicals, and soon we're going to start doing DOT physicals, but we do school physicals, we do work physicals. So like I said, there is, you think of the service that you can get in probably 2 or 3 different places, and you probably can find everything here under the umbrella at DelCare Health Solutions.
Absolutely, that's great. Yeah, that's great. I think I'll have to bring you so that we can talk about one of those. I'm not sure what it is. One of the chronic disease management, it could be on diabetes or maybe high blood pressure. Just kind of have like a whole topic on it. I want to run a series to inform our community. I know there are a lot of materials over there about all this high blood pressure, diabetes, and stuff like that. I want to try and run a series on that. So hopefully you create some time in your busy schedule to stop by and do this as well.
We'll be happy to do that. I would be happy to do that, Kof. And I have students that come through from time to time who are would be really happy to also chime in, and we could do, because from time to time they want to do these things because they have to get certain amount of hours or certain types of skills in terms of their clinical hours. So absolutely would be thrilled to do that, because again, in the community, what I see my brothers and sisters who need help. DelCare, I must say, largely one of the reasons that we're located here at 2801 Lancaster Avenue was the decision was a strategic one. So we could appeal to the underserved community as well as other. So this is a very diverse area that we're located right now. So the goal was to appeal to basically everyone. The goal is for us to build, if you look at our mission and our vision, we want to work collaboratively, wholeheartedly, so we can provide care to those individuals. Like I said, a lot of times I find, and if you think about it, healthy people 2020, 2030, now 2030, a lot of times if you're able to provide, the care that you're receiving is provided by someone that you can relate to, a lot of times you're more apt to adhere to your treatment regimen, right?
Yes.
A lot of times I find that there is patients come to me and they come with issues because they're not adhering to the regimen they were on with their provider, or they simply don't understand. A lack of understanding cause a lot of issues a lot of times with our patients. And so taking those extra 5 minutes to just help them understand the importance of being able, okay, this is why you do this. And sometimes a lot of times I said, ask them, tell me what it is you understand about what we're doing here. Like, do you understand why we're doing it?
Right.
And so, and there's so much chronic problems, I think, in terms of our community, especially the Black community, there is a lot of chronic problems. And whether it is the challenge because we have to go to work our 2 and 3 jobs, I am not quite sure. But a lot of times those problems go untreated, and even when diagnosed, there's there's a lack of attention to the issue. And so that is one of the things that is coming on stream for DelCare Health Solutions, because we are literally thinking of bringing in groups of people to come in, come into our conference room, sit with us, help us understand what it is what are the challenges people face in terms of not taking their medication. Why is it adherent to your medication regimen? And we also currently are partnering with the Era University to look at a study for mental health, which is another challenge, right, that we face in our community. So, like I said, we are just busy putting ourselves into these spaces, trying to ensure that we're penetrating healthcare, providing healthcare from a meaningful perspective to the underserved as well as others.
Yes. So that's great. So how do you envision the future for DelCare Health Solutions?
So that is a really good
You're
question.
4 years in right now.
Yes. Yes. I'll say this to you. I shared with one of my patients this morning, said, my accounting professor back in Jamaica, he taught us, he said, every day of accounting class, he would say, shoot for the moon. And if you land among the stars, you're in good company. Okay. And so at DelCare, the goal is to reach the people, again, like I said, who have long been forgotten, long felt like, healthcare, they're not being seen or heard, or, the care that they're receiving might, not be how they expect it to be. Because one of the things about providing care is that sometimes we don't provide care from a cultural perspective, and at DelCare, these are the things we take into consideration. And so, with that said, the for DelCare, the sky is the limit. We'll shoot for the moon. We're shooting for the moon. And if we land among the stars, then we'll be in good company. So for DelCare, like I said, the aim is to grow. The aim is to provide quality, high quality, meaningful, evidence-based care to patients. The aim is to ensure that we can reach as many people as possible. The aim is to ensure that we become Delaware's preferred family practice. And so, we continue to work. I said this, I humbly say this to you, that my hope for myself as a human being is that when I depart this earth, I would have made an impact.
Wow. Yes. That is great. And that even drives me into what your experience and the impact that you're talking about drives me into something that Maya Angelo said. Actually, it's one of the pictures I saw in your practice, and I just like, I have to write this down. And I quote, I have learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel. And that was by Maya Angelo.
Yes, the great Maya Angelo.
Yes, and that is so impressive. It's all about the experience.
Yes. I have conversations with my staff at DelCare Health Solutions between 8:15 and 9 o'clock every morning. We talk about the patients who are coming in. We're getting ourselves set up. And that way we have an idea, because we want them to feel like they're a part of something. And I typically say to them, I said, patients, if you treat someone well, they might remember you. But if you don't treat someone well, they will never forget you. So just as you talk about Maya Angelo, they won't forget you. And so we strive at DelCare to just ensure that we're providing care with a smile. We're providing meaningful care. Again, the goal here is to make an impact. The goal here is to connect with the wider society. And whether, like I said, whether DelCare wind up providing care for people in Delaware and eventually in West Africa and in Jamaica and, in the Bahamas, or, I could keep going. The goal, again, for us is to ensure that we're providing care that is meaningful. We're providing care we're taking everyone's culture, right? And so we continue to strive to develop cultural competence, right?
Yes.
Because we live in a diverse society. Our aim is to ensure that by the time our work here is done, that we would have significantly reduced, certain morbidity and comorbidities, and mortality in our little area here of Wilmington and wherever else we choose to practice, Kofi, wherever else we choose to go.
Thank you. Impact
Yes,
all the way.
making an
Yes,
impact.
experience. So, what is your final message to our audience and also people who are inspiring to get into healthcare? Okay, both here and abroad in the Caribbean or in Africa. What is your final message for them?
I want to just take the time out to say healthcare is fundamental to our existence. Healthcare is our lives, our livelihood, right? And so with that, healthcare demand people who are committed. Healthcare demand people who are willing. Healthcare demand people who have a heart for people. And so when you think of the crucial roles that we play in society, like I said, you want to strategically position yourself to be there to serve wholeheartedly or reconsider where you want to be. For those who are considering healthcare, please understand again that you are going to be making decisions that are impacting people's lives on a daily basis, right? It is crucial though. We need committed people. We need people who are willing to work. We need people who are able to collaborate. We need people who want to expand the horizon, right? We need to, and so for us as older healthcare professionals, or more experienced, for choice of a better word, let me be careful. We must endeavor to give back to society where and whenever or whatever way we can. Please remember that the upcoming students, and whether it is the registered nursing students or advanced practice nursing students, they are going to be the future. And so while we move into, our years of retirement, let us endeavor to ensure that we're giving and we're pouring into a profession that has given so much to so many of us. And again, I will say that amidst the challenges. But I would invite anyone, if you have the heart, if this is something you want to do, nursing, you can't go wrong. There is 102 professions for nurses. Please, think about it, take some time, read up on it, do your own research, see if this is something that you want to do. Again, because it is a very noble profession, but it is also a profession that you have to have the heart for. It has to be. Medicine is something you have to want to do it to do well at it, because again, your impact is people's lives. I'll also say this: when you look at the challenges that we face, and now I could take us back to COVID and all that was taking place, it speaks to the importance of having people who are willing to work, who want to do this, want to be a point. Look, let me just say this: nursing is a movement. Okay, I urge you, if this movement is something that you want to be a part of, if technology is increasing every day and things are changing and new technology, things are developing, and if we're an evolutionary profession, but we are a noble profession. We are strong. We're growing. If this is something you want to do, please tap into it. Because whether it is directly providing care to patients, or whether it is working behind the scenes as a case manager, or whether it is working in, like I said, in hospice, right, for those individuals who need you, or in the classroom, or precepting, in whatever aspect, please let us, like I said, just continue to work. And I invite you to take a look, like I said, at all the different things that we do as nurses, but not forget that amidst what looks sometimes glamorous in our profession, beneath that glamour comes the challenges of committedness and the willingness to get in there. And for those of us, again, who are advanced practice nurses, look, people, we have individuals that need help. Mental health is one of those growing areas that really need strong people. And so don't shy away. If this is something that you are ready to do, you are ready to take on, I encourage you. Just grab your computer and start searching for that university that might have that program that fits your schedule, again, so we can do some more collaboration. We can continue to work. We can foster good health in our community. We can build healthier communities because that is what we need to move forward.
Thank you, Dr. Nadine, for that advice. Dr. Nadine Lindsay, I really want to thank you for taking the time out of your busy schedule to be here with us. It was really great having you on this podcast, and I pray that you grant me that open door policy to bring you back here again.
Yes, Mr. Kofi, I thank you so much for having me today. Thank you for allowing me to come on your platform, just to talk about my organization, not so much myself, but, my profession. I totally appreciate you and the great work that you're doing in the community. And I hope that you will continue to grow from strength to strength. Totally appreciate you. And I'm willing to come back on, like I said, so we can talk to the community directly about some health and wellness issues that are, I'm just burning. I want to share. I want this to be a shared effort where I can teach my people, they can learn from me, and they can also teach me some things. So thank you so much, sir, for your time. Thanks for having me.
Thank you, Dr. Nadine.
You're welcome.
Thank you for joining us on this episode of the Uplift Chronicles. I hope you found inspiration in today's stories and the spirit of upliftment. Remember, every life has the power to inspire change, and every story is a thread in the rich tapestry of our shared heritage. If you enjoyed this episode, kindly subscribe and leave a review, and share it with someone who could use a little upliftment in their life. Follow us on social media for more updates and join the conversation. Until next time, keep uplifting and stay inspired. Signing off, this is Kofi Dake.